Greetings, welcome to Hangouts with Hive. Today's topic is Prep for Women, the San Francisco Story. My name is Yamini Oseguera Bhatnagar. I am the Power Health Coordinator at Hive, which is a hub for positive reproductive and sexual health. It's the 19th of January, 2017, and I'm broadcasting live from San Francisco, and I'm rocking my Please Prep Me Pillbox earrings. Thank you, Shannon. Why are we talking about PrEP for women in San Francisco? First off, pre-exposure prophylaxis was approved by the FDA as an effective HIV prevention tool back in 2012. PrEP works for women. It has also been found to be a viable option to prevent HIV acquisition among women. And in San Francisco, champions within clinics and agencies across the city have now made PrEP a possibility for many, many women. We brought this group of folks together, welcome everyone, and to be our panelists, and they will tell us about how they've navigated the system in various ways to offer PrEP to women and bring access to PrEP to women who need it. There's great work happening in San Francisco as well as throughout the country. Shout out to all who are PrEP for Women warriors throughout the country. There's lots of work being done to raise PrEP awareness among women as well as bring PrEP to women. This in particular is a San Francisco story. I'm joined by really wonderful colleagues today. Shannon Weber, Dr. Nika Seidman, Miranda Nordell, Claire Simeone, Jennifer Sarche, and Dr. Deborah Bourne. Welcome and many thanks for being with me today. What we're going to do is start off with a little bit of a historical perspective. I'm going to hand it over. I'm going to tell you a little bit about Hive first. Since 1989, Hive, which is formerly the Bay Area Perinatal AIDS Center, or BAPAC, has provided preconception and prenatal care to women and couples affected by HIV. Since 2004, all babies born in San Francisco have been free of HIV. Our mission is advancing reproductive and sexual wellness for individuals, families, and communities affected by HIV in San Francisco and beyond. And our vision is to see a world where people affected by HIV have safe pregnancies, reproductive autonomy, access to state-of-the-art healthcare, and enjoyable sex lives. A couple of tips for our viewers as you join in. We will broadcast for the next 60 or so minutes. During this time, as you listen to our panelists, please think about questions that you may have for them and ask those in two ways. One being, type them in the comment box right there on YouTube, and we'll follow along with you, or text them to that number. That's 415-842-2722. Again, that's 415-842-2722, or type them in the YouTube box. If you like what you're hearing, join us on Twitter. We love getting on Twitter, and we're using the hashtag Where's My Prep. So join us there if you would like. And if you're watching a video of this Hangout after the live broadcast is over, look at the info section for a link to resources that we will publish soon after. All right, and with that, I would like to invite my wonderful colleague, Shannon Weber, to talk to us. Shannon is the director of Hive and the founder of PleasePrepMe.org. She is passionate about creating a world where women have sex and babies when, where, and how they want. Shannon will start us off today with telling us how it all began here in San Francisco. Take it away, Shannon.
Awesome. Thank you for organizing, Yami. This is so exciting. So this is an idea that we had come up with several months ago, in part because Yamini and I were having calls with some other cities and learning about how they're rolling out PrEP for women. And I love hearing these details and other people's stories. And so we thought, well, it'd be good for us to tell our own story and kind of create that path forward so that we can also highlight and learn from others. So that's our effort to do that today. So I want to get a little bit of background about SF. to just lay the context for some of these stories that you're going to hear later from some of the other participants on the Hangout. So San Francisco in 2014 had 14 new diagnoses among women, and in 2015, which that had seen a steady decline down to 14. And so it really goes to show San Francisco is a geographically small town where it's 7 miles by 7 miles. There's this real concerted effort around getting to zero HIV transmissions in San Francisco. And over time, the epidemic has become in fact, increasingly among gay and bisexual men. So we had the 14 women diagnosed in 2014. In 2015, it went up to 35 women. About half of those women, the new diagnoses were from sex, and about half from people who inject drugs. The majority of those women with new diagnoses last year were Black women, and the majority of the women were reproductive age. So this is concerning to us, but I wanted to give a sense of just the numbers to kind of ground people, because it's different in different areas. Another thing that's really unique about the San Francisco story is the health insurance coverage that we're frankly really blessed with as Californians and also as San Franciscans. So when we're going to start talking about PrEP being rolled out in 2010 to women, even at that time, before the Affordable Care Act, there was a program in San Francisco called Healthy San Francisco. And this meant that nearly all, or essentially all folks in San Francisco were eligible for some health insurance program. And there was particularly lots of services available for women around pregnancy, which is where some of our early PrEP work started. There was also really early rollout of use of the medical assistance programs offered through Gilead here in San Francisco. So as there was this shift from Healthy San Francisco to ACA, and there were some gaps for folks, and there was a lot of juggling with coverage until we really learned how to enroll all folks on ACA, we were able to do some early exploration of patient assistance programs. So why are we highlighting San Francisco today? Because there's lots of places doing amazing work about women in PrEP. And so this is so not about saying, hey, look what a good job we do, or look at us. It really is like, hey, we're going to go first because we want to come and talk to you next. And so it's about creating this dialogue and learning. Also, there were early innovators and adopters around PrEP here in San Francisco, which we'll talk about. San Francisco also has had zero perinatal HIV transmissions since 2004. And so for many of us in the perinatal HIV world, this idea of integrated treatment and prevention, or this idea of a biomedical prevention method, was not as foreign, not as it was for some folks. This is not that all people in perinatal HIV jumped on it, but at least among the folks thinking it through here in San Francisco, this really made a lot of sense to us. And something that we like to do at Hive is create templates, resources, getting feedback from people, lessons learned. And so San Francisco also nucleated some of those early efforts around women in PrEP. There's also the distance-based consultation service, the Perinatal HIV Hotline, which really helped to lead this conversation nationally. All of this happened in San Francisco with little or no dollars allocated to HIV prevention for women, and specifically no dollars for PrEP for women. In fact, in San Francisco, HIV testing for women is not even covered from the Department of Public Health, given the low numbers of women that are newly diagnosed and the prioritization of public funds. So I also think it's awesome to look at what's happened in San Francisco. It's really been about leadership, believing in women's health, stepping forward, and not because there was some specifically funded effort. That will also explain some of the hodgepodge or scrappy nature of how things have rolled out. But that's what happens when you go first, and we hope that that can be lessons for other folks to learn from, and they'll be able to do it faster. So who now? I really want to talk about the pioneer in San Francisco offering PrEP to women, Dr. Deb Cohan, who's the medical director of Hive Clinic, and she also is the director of the Perinatal HIV Hotline. And she began offering PrEP to women at Hive Clinic in and around pregnancy in 2010. So this was before the FDA approval, and it was also during that period when there was really lots of ups and downs about the information coming out about the efficacy of PrEP for women, and we were still really processing, all of our messaging around that. But I would say something unique about perinatal HIV folks too is that in many ways we uniquely recognize the vulnerability of women and the opportunity that we have when women do engage in the medical system. And so there was this tremendous hope that PrEP would offer another tool that women could choose to use that to protect themselves. So Deb Cohen's early work was followed by Dr. Lauren Poole, a nurse practitioner, who in my mind, as I was thinking about this, I think really played the role of the first PrEP navigator. Like, you know, a navigator can be a person or it can be a series of people doing navigation services. And Lauren Poole worked tirelessly to figure out how pre-authorization would occur, sorting out prescription pickups, dealing with Healthy San Francisco when they pushed back about a woman who wanted to breastfeed and take PrEP. And so she really helped like make this path forward that we were able to say it's possible to offer women PrEP. Women want PrEP, and then here's how you navigate some of the issues with coverage. This was also, there was also collaborations with City Clinic, and some of this also was nucleated by work that was done through our Pro-Men effort, which is positive reproductive outcomes for HIV positive men, really engaging with providers and men themselves who are living with HIV and finding out about their partners, coming up with resources for those men and their providers, and then looking to make rapid referral for their partners for HIV testing, PEP, and PrEP. There's many, many other people who've played important roles. Some of them you'll see on today's Hangout. And in this process, we are still learning how to navigate women who navigate with and for women who experience intimate partner violence. How is it that we can move beyond this pregnancy model of care where women have a lot of intensive services provided to them to this integrated primary HIV prevention for women? We've learned in this process you can rally providers and systems around pregnancy, and it's in some ways easy to access expanded services for safer conception, but we're still thinking and learning about how we can do that generally and more broadly for women. So what can we really learn from San Francisco, I think, is that we can take small steps and that individual people can really make a huge difference. You'll see that today as we highlight some of these women's work who are with us today. And really, we can learn also that we can expand beyond women's pregnancy intentions to find ways to create this like safety net of HIV prevention services, regardless of whether or not they're pregnant. I really want to honor the folks who are on the Hangout today, that these are women who've gone above and beyond. They did not wait for someone to give them permission to do the right thing. And these are really yes people, which I'm so grateful for their work.
Great, thank you, Shannon. That was really inspiring. What we'll do next is hear from Dr. Nika Seidman, who's really going to tell us a little bit more about how PrEP was operationalized within sort of the medical system here in San Francisco. Dr. Nika Seidman is an obstetrician gynecologist and fellow in family planning at UCSF. Prior to fellowship, she was a clinician at Hive and the National Perinatal HIV Hotline. Her research focuses on integration of HIV prevention and family planning services. Thank you for being with us, Nika. Take it away.
Thanks, Yamini. Before getting started, I did just want to do two things. One was to echo what Shannon said about how we really hope that this Hangout today starts a conversation, because what I really want to hear, more than hear myself talk about operationalizing PrEP in San Francisco, is hear what other cities are doing and how we can do a better job. So the more people can ask questions and give us their ideas, the better. I also wanted to recognize that Shannon talked about how Deb and Lauren Poole were pioneers in San Francisco around HIV prevention services and specifically PrEP for women. I think it would be a huge error not to say that Shannon was one of those pioneers too. And it's really awesome that she's on this Hangout. And she was too humble to mention herself, but she was a critical pioneer in the field. So I'm going to talk a little bit about the somewhat dry topic of operationalizing PrEP for women in San Francisco. And I think that when we think about the introduction of any new innovation in healthcare, we can think about diffusion of innovation. And this is an idea stolen from Bob Grant, but I think it applies really nicely to this Hangout. Shannon talked about the pioneers, and these are really the innovators and the early adopters of PrEP uptake. And what I think we've moved into is a phase of the early majority, even maybe the late majority of providers being involved in, or at least knowing about PrEP for women, offering comprehensive comprehensive HIV prevention services. And I'm going to try and tell a little bit more of that story. Some of the key people in that story are on this Hangout as well, specifically Miranda, who has done a tremendous job of getting the word out around PrEP and women around the city. And, you know, I think we're certainly not to this last phase of that cascade where we think about the late adopters and the laggers, but we'll get there. I'm optimistic. And so with that, I wanted to talk about kind of 3 key parts of operationalizing PrEP for women in the Bay Area. And what those 3 key parts have included have been training of providers, systematizing our thinking about how we reach women, and then lastly, recognizing how PrEP services and comprehensive HIV prevention services require partnerships with a huge variety of different groups if we want to serve diverse groups of women. So I'm going to talk about each of those in turn, but I wanted to start with talking about training. So I think when I think about my own training as a women's health provider, and I'm a physician, I'm an OBGYN, and then when I think about my residency training, I got 0 training on comprehensive HIV prevention services in general, let alone PrEP. We talked a little bit about condoms for STI prevention, but really very little more than that. I started working with Hive right out of residency, and what we learned over time was we'd get these questions all the time from the field, from these, not from the pioneers, but from people who were really great listeners, hearing from patients what they were looking for in terms of what they needed in terms of HIV. Those questions repeat themselves, and what we recognized is that we needed to start doing training of providers. This motivated us to reach out to groups of providers who see at-risk women, and we knew, again, that about 40% of women around the country exclusively see reproductive health care providers. And who are they? Those are providers who provide pregnancy care and family planning care. Interesting that women were getting referred to our clinic in really inconsistent ways, and that we needed to have some type of kind of more comprehensive approach to make sure that all providers were able to refer to us and knew to refer to us or to provide direct services. And then lastly, we did, to kind of better understand if this anecdotal experience was reflected nationally, we worked with the National Family Planning Clinical Center, Training Center, to do a survey of Title X providers around the country. And we surveyed a couple hundred providers, and it was a really simple survey. We asked providers about if they'd ever seen PrEP guidelines, if they knew what PrEP was, if they knew about what the efficacy of PrEP was in trials, and what type of HIV tests they would order if they saw someone who they were worried about acute HIV infection in. And what we found was that less than 1/3 of providers had ever seen any HIV prevention guidelines like PrEP guidelines. Less than half of providers around the country could identify exactly what PrEP was, how well it worked, and could identify the right test to order if they were worried about acute HIV. And so that really motivated us further to focus on training. So when we thought about training in San Francisco, I wish I could say we had this comprehensive training plan and map. Really, I think what we started with, 1 minute, my goodness, was trying to reach as many providers as we could early on. And we talked to anyone who would talk to us. Those included trainees, those included people, not only women's health providers at both family planning and pregnancy clinics, but also people who were in touch with women who were at risk of HIV. For example, we talked with people who were providers of men living with HIV who might see partners. So we did a ton of trainings around the city, and in addition, have started more recently to focus on trainees. Through this training, we recognized that we needed to systematize our work in terms of how to identify at-risk women. And that is a whole nother conversation, and it's a complicated conversation. But what we recognized is that providers needed a way to systematize what they were doing in terms of screening and document it, and then have an opportunity to do something with that screening. And so we did that through electronic medical records, and we have basically used the CDC guidelines to develop a simple series of questions that we've integrated into the EMR to state if people were screened for HIV vulnerability or not. These are not perfect screening questions. They're based on CDC guidance. But one of the key aspects of that was making sure that providers had room in those conversations for women who didn't know if they met CDC guidelines or not to use other resources. And Hive came up with things like the Palm card, which Yamini will show at the end, which basically says that these screening criteria are not perfect, that we want to welcome anybody who feels like they have a vulnerability about HIV into conversations with their provider about comprehensive HIV prevention services, and then where to get more information. And that's where we're hear a little bit more from Miranda. One key aspect of that operationalization was recognizing that people like medical assistants, people like health educators, people like counselors are really on the front lines of screening and need to be empowered to have those conversations with patients because they're getting critical information from patients that might not be disclosed to a provider. So training all frontline workers has been really important in terms of making sure that we get training out to everyone who needs it. My last point, Yamini, I promise I'm finishing, is that over time we've recognized that while initially our HIV prevention service programming was really focused on within pregnancy, that there are a ton of different types of partners that we need to work with in order to get these services out to women, both inside and outside of pregnancy. And in addition, recognizing that women who are at risk of HIV have the same types of life circumstances as women living with HIV. So those same concepts of integrating things like methadone clinics, the homeless outreach team, all different types of providers spanning from family planning providers to pregnancy providers. All of these different groups need to be involved in order to reach the most women. And that's what I think is the most exciting part of this panel, that we have many of those partners on, and I'm really honored to be on with all of you. Thanks.
Thank you, Mika. You blow us away every time. I just want to quickly put a plug in for our Twitter presence, which is #Where'sMyPrep. Talk to us, tell us what you think, tell us what you want us to talk about in the future, and also engage with our YouTube chat session and ask us whatever questions that you feel like are on your mind. Next, we will hear from the wonderful Miranda Nordell. Miranda is the PrEP coordinator for San Francisco Health Network, where she helps folks get access to both PrEP and primary care. She dedicates much of her time to helping women and youth of San Francisco access quality PrEP care. Miranda will tell us about her work with women and youth and linking people to PrEP care in San Francisco. Take it away, Miranda.
Thanks so much, Yamini. I just want to echo some things that were already said from Shannon and Mika around if we're going to get to 0 new HIV infections, we really need to be creative in how we're engaging women, right? Both in preventing HIV, but also in helping us spread the word and engaging women as change makers in their community. So I'm really excited to hear from others' feedback and some of those creative ideas. So I'm going to frame my snapshot today just to give a little overview around some natural successes we had around PrEP in women, and then some areas where we needed to really roll up our sleeve and take action. And as Nika mentioned, places where we're still pushing forward and learning. So when I first started in that PrEP coordinator role that Yamini mentioned in late 2015, I was placed at Ward 86 at San Francisco General Hospital. And for those who aren't familiar, it's really an amazing place, a world-renowned hub for primary and specialty care for those living with HIV. It's been here since the height of the epidemic in San Francisco. And over time, really over these decades, folks would bring in their partners and they'd say, I want my spouse who's not living with HIV to get the same great care that I'm getting. Can they come here? And so the staff, when I started, would describe to me how hard it was for them to say, I'm sorry, that's not how we're set up. We're here for that great care for folks living with HIV. So it was exciting to be able to come in late 2015 to start a PrEP clinic and allow that to change. And so then we were able to go back and invite patients to bring their partners, to learn more about PrEP, to decide if it was for them, and provide an opportunity for folks to not only receive wonderful prep care along with their partners at Ward 86, but also primary care. We learned that that was really important, and that's really a unique model in San Francisco that our clinic provides. Perhaps not surprisingly, a lot of these partners were women. And it was really important for them to have the ability to have this one-stop shop where they could get that great prep care and then also primary care to really limit disruptions and sacrifices in their schedule. A lot of these women had been out of care for a decade or more, and this was a really big change for them, and we were really excited to provide that. So we quickly discovered that unlike many of our amazing clinics in the city, our prep panel is about 50% female identified, which is really exciting. And a few months later, in early 2016, my role expanded, as Yamini alluded to really work on some large initiatives around prep and youth. So we're really excited in San Francisco to offer prep to youth over the age of 12. And I began working with two of our amazing youth serving clinics, the Larkin Street Youth Services, which is downtown in our Tenderloin district, for those familiar with San Francisco, and then our Huckleberry or Cole Street Youth Clinic, which is out in Haight-Ashbury. And both of those serve youth 12 to 24 of all genders. But we were able to successfully integrate prep work into existing programs, like working with case management staff to include questions relating to HIV prevention on intake forms, and working with providers to integrate prep counseling and referrals into work they were already experts in regarding pregnancy and STD prevention. And helping youth see that PrEP could be another tool in their sexual health toolbox. And we found through conversations that this was especially empowering for young women who had been really having these conversations for years around, how do I negotiate with my partners around condom use? How do I feel safe? And then here comes PrEP as this amazing self-taken tool where they don't have to disclose to partners. It's something that they can feel empowered to take on their own. And that was, those conversations were really amazing to have with young women between 12 and 24. And because of the areas where these clinics are located, we work with many young women who are marginally housed. We're participating in survival sex work, trading sex for food, money, housing, and getting these young women on PrEP was a natural step. So we were really excited to integrate into those opportunities. Also, as we integrated PrEP into all of our primary care clinics throughout the Department of Public Health, referred to as our health network, we made sure to prioritize screening and counseling specific to multiple populations, including cisgender women or those who might have vaginal exposure to HIV. We noticed in a lot of the otherwise wonderful trainings that we attended that it was very directed towards men who have sex with men, which, as Shannon mentioned, makes a lot of sense for the epidemic. But again, if we're going to get to zero, we need to make sure that we're incorporating all folks who might be candidates for PrEP. So it was really important for us. Moving beyond some of those low-hanging fruit, we started examining some missed opportunities for women to be offered PrEP, right? And I think both Shannon and Nika discussed this a little bit, but when you have 35 new HIV diagnoses among women, you have an ability to examine cases individually. And so we brought stakeholders for both women's health and PrEP care to the table and really examined these individuals, discussed these gaps. And so one place we started was writing letters to the medical directors of clinics where at least one woman had tested positive for HIV. And we offered, right, how can we support you? How can we help fill in these gaps? Can we come and offer a training to your providers? Can we work with your medical assistants around screening women and others for PrEP? And so we certainly got feedback that there was a need for more materials relating to PrEP and women. And so further utilizing these stakeholders, we created some specific resources. And one of them was the PrEP card, which sounds like Yamini's gonna show you, but I'm gonna jump a little bit and show it as well. And so this amazing PrEP card, which just gives a short definition of PrEP, right? One that we felt would be user-friendly. And it also describes some scenarios when women might wanna consider PrEP, right? And so, as Nika had mentioned, it's difficult to screen women effectively for PrEP candidates. Their risk, so to speak, often depends on being really knowledgeable about their partner's behavior, which is very difficult to do for someone of any gender. And their risk can often change really quickly, especially among the young women we work with. So we really tried to think of as many opportunities as possible for someone to be thinking about this and having these conversations. So we decided to take our show on the road and work specifically with organizations and some groups that serve girls and women. And so some of these included some clinic-based resources, right? Beyond our primary care, we also went to our women's choice or abortion clinic. We worked with the prenatal care providers. We also decided to get a little creative and move beyond clinic-based resources. So I started going into women's-based shelters, working with providers and case managers that worked with women who experienced intimate partner violence or sexual assault. I went into college residence halls and did nighttime activities with young women, went into high school-based health groups, and we got to learn a lot from these conversations. And one of the really important things that I learned is that 0% of women looked at PrEP as an option for them. The very few among ages, among demographics who had heard of PrEP saw it on those posters with, you know, men excited and dancing and thought, no, I understand that's for men. What is there for me? And so it was really exciting to be able to have those conversations and allow women to decide if PrEP was a good fit for them. Thank you. So we just want to say that it's important to speak with providers as well as potential PrEP users. There's many women who are just not going to be great candidates on paper, and so that they might be very much interested in a good fit for PrEP. And so only training the folks who are doing the screening is going to miss a lot of women. So thank you so much.
Miranda, thank you for your work. And I just want to point out that all of our three panelists so far have really driven home the importance of folks working together, and the navigator position, like Shannon was saying, kind of not being just one thing, but lots of people really putting in the effort to make this happen. Next, we're going to hear from Claire Simeone, who is a family nurse practitioner who has her clinical practice at the Opiate Treatment Outpatient Program, which is San Francisco General's methadone treatment program. The program serves a population with high rates of homelessness, psychiatric and medical comorbidities, and polysubstance use. Claire has been involved in HIV care since the 1980s. First as a hospice nurse in San Francisco, and then as an HIV primary care provider for 15 years in Sonoma County. Claire completed her Doctor of Nursing practice at Johns Hopkins last spring with a focus on the provision of integrated services in substance use treatment settings. Claire will talk to us about rolling out PrEP in the methadone clinic setting and also talking with women about HIV prevention.
There, I think I'm unmuted now. Thanks, Yamini. And I'm really so honored to be asked to be part of this panel and share a few thoughts that I've been having over the last year about prevention for our women here with you today. So what I'd like to do in my next 5 or 7 minutes is to give you a snapshot of who we see in our methadone clinic and a little bit of my perspective on why PrEP is important for our particular patient population, and then share our very initial work around what we're doing to address PrEP for women and PrEP for all of our patients, in fact. So we're an urban methadone clinic. We have about 550 patients on methadone treatment, at any one time. And we serve about somewhere between 600 and 700 different patients a year. And 10% of our patients are people who live with HIV, and approximately a third of our patients are women. We also provide opt-out HIV and hepatitis C screening at intake and annually as well. And about 10% of our patients decline HIV testing, most often because they've had a recent test. We also have multiple services that are not specific to methadone, but really integrate well with our methadone treatment, and we're able to provide on-site both treatment for both hepatitis C and for HIV. We provide some psychiatric care on-site and case management. And we also have the opportunity, which I think is a wonderful opportunity in methadone treatment programs, to be able to provide directly observed medication therapy. And we do that for HIV medications and hepatitis C medications, as well as some psychiatric medications for some of our patients. As Yamini said, our patients are about 50% homeless, and interestingly, in our patient population, our women are more likely to be homeless than our men. At least half of our patients are challenged by polysubstance use, in particular cocaine, methamphetamine, and alcohol, all of which we know are related to higher risk of HIV acquisition. And many of our women, as well as our men, but particularly focusing on our women, suffer from serious mental illness, PTSD, and extensive trauma histories. And note, very few are engaged in any kind of medical care other than perhaps emergency room care when we see them at intake. So as Shannon said in the introduction, sort of why be concerned about PrEP in a city from my perspective that has like incredibly excellent harm reduction and needle and syringe program services, and where the HIV prevalence and new infections are driven by men who have sex with men. Well, what got my attention a couple of years ago was the San Francisco EPI report that reported on the national HIV behavioral surveillance data that said that 40% of people who are infected with HIV who inject drugs in San Francisco actually didn't know their status. And I started to think about that and think about the social networks that our patients both use drugs in and also have sex in, and began to be concerned that maybe we need to be thinking about this in a different way. In my tenure, which is 7 years here and now at OTOP, the Opiate Treatment Outpatient Program, we've had 4 seroconversions because we test really regularly. We're able to track pretty well. And because, even though we have 30% of our women in our population, 30% of our population is female, 3 out of 4 of those new infections were among women. 2 of them were not injecting drugs during the time that they seroconverted, and 1 of them was, and also has sort of high-risk sexual activity as well. So I think it just points out that even though we are often thinking about methadone and injection drug use as the risk, we must really think beyond that to the other multiple risks that our patients may face. Other thing that came to my attention pretty recently, and we've just been noticing this, and we don't have really hard data on it, but we've noticed that we've had about a doubling of pregnancy among our women patients in the last year. And so that's just, I don't really know how to explain that. I just know whether we have younger patients now, I'm not really sure. We haven't drilled down on the data, but it does make me aware that these are unplanned pregnancies, and so that could, again, carry STD and HIV risk along with it. So I've started really asking women a lot more about their interest in PrEP just in the last couple of months, and like has been echoed through my fellow panelists here, women aren't really aware about PrEP. They're really kind of stunned that there's something that actually could prevent HIV, and they haven't really heard about it yet. So what are we doing? We talked a lot about collaboration so far on this panel, and we talked about provider education. So in methadone clinic, you have the luxury of having a lot of counseling time, and it's mandated for our counselors to spend a certain amount of time with patients each month. And we have some work that we do that is specific around HIV and hepatitis C prevention. So we wanted to really build our staff awareness and staff knowledge base about PrEP. And I think most of our counselors and our medical staff have heard about PrEP, but I think there's a lot we could learn on how we actually approach patients and discuss and have a really comprehensive PrEP discussion with them. I was recently at the National PrEP Summit, and one of the bylines I loved was from the Kaylin Lord Clinic in New York, which was, PrEP is not for everybody, but everybody should know about PrEP. And again, as has been echoed here previously, I think we don't really understand in quick interactions really what someone's risk for acquisition for HIV is. And when we just open the door and give information, we let the women decide what's right for her, and I think that's really critical. So what we're doing is really building a referral system at this point, and really working on providing warm handoffs to the key PrEP providers in the city. And we are also working on building a tracking system so we can see how this goes. In my ideal world, I would love to be able to provide directly observed PrEP therapy here. We're actually expanding several of our other services this year, so I don't think that's going to happen this year, but I think we can keep it in our minds as a dream. And I think what this provides is some opportunities for us to work with our women around issues of self-efficacy, and of course HIV prevention. Also, as very few of our women at intake have any link to any kind of sexual health and family planning services, and I think this is an opportunity to really build on that as well. And overall, really maximize the opportunity for women where they choose to seek services. Some barriers in methadone clinic would be funding, for sure, because methadone clinics are funded in a very particular way. So in summary, I think PrEP is a biomedical tool that's really important. And I want to just echo the fact that my personal perspective is that it's important to think about that as a tool that also goes along with other risk reduction strategies for our population, which is harm reduction and needle and syringe programs, opiate substitution treatment like buprenorphine and methadone, housing, and decriminalization. And I think some of these social issues are even more important as we move into the next 4 years in our country. Next slide.
Thank you, Claire. One thing I just want to echo is that you and the folks at OTOP are really modeling being open to learning how to work with folks differently, how to ask different questions, and just being open to learning as approaching people. Thank you for that. We're running short on time, so I will jump right over to Jennifer Sarche, who is the Center Director of Planned Parenthood Northern California in the San Francisco location. She's been with Planned Parenthood for over 10 years and started her Planned Parenthood career at a Texas affiliate. Jennifer is going to tell us about rolling out PrEP in the family planning setting in San Francisco.
Thank you, Yamini, for having me here. In preparation for this talk, I realized it was a good learning experience of where we are with our PrEP enrollment and providing that service. So I'll just go into highlighting where we're at the Planned Parenthood in San Francisco. So PrEP protocols and services were rolled out at Planned Parenthood Northern California, which is the affiliate that the San Francisco location is part of, in June of 2015. At that time, we rolled out, our protocols. Also, there was training materials provided by our training department, presentations done at our staff meetings around that time. And then weekly email updates that we call hot flashes went out to staff about PrEP and educating. That's the education that we provided to the providers and the medical assistants. We also printed out some hard copies and got resources that we could use in the center to provide support for our staff to educate our clients on it. Planned Parenthood San Francisco sees about 1,400 visits per month. So we're a pretty busy family planning clinic. About 86% of that is women and 14% of that is men. But since our PrEP enrollment rollout or PrEP services rollout, which we have seen a small population of individuals coming in for PrEP. We've had 35 individuals who identify as men come in for PrEPs, and about 12 individuals come in who identify as female come in for PrEP services. So it's a very small percentage, which is kind of surprising. We did participate in Dr. Seidman's survey around family planning and access, and they reported about 7% of women reported met criteria around CDC guidelines about needing access to PrEP or were at risk and would be good candidates. So obviously we're not seeing that same number in enrollment. So I started to wonder what it was. Why are we not seeing more individuals on PrEP? Majority of what we're seeing is individuals coming in asking for PrEP. And often those are pretty straightforward individuals. It may be individuals who identify as men who are engaging in intercourse with other men, and so therefore their risk factors are there. Usually we're helping navigate, whether they're uninsured or insured, and getting them on PrEP and making sure that their insurance resources are paying for that. But the not so straightforward and in this talk and talking about is women, and why, the majority of our clients are women, that we are seeing women who have the risk factors. What is it that we're missing in the opportunities of engaging and educating our clients around that? And I think it's a combination of things. I think we need to provide staff with more supports around education, and also doing a culture shift. One of the things I thought about is how in examining PrEP services, it reminded me of the times in family planning when we started rolling out reproductive life planning and LARC services. so long active reversible contraceptives. And, you know, in my early days of Planned Parenthood, it was mostly women coming in asking for Mirenas or Paraguards. But we did a culture shift of that was a discussion. You know, it shouldn't just be people requesting it. It should be us engaging and talking about these preventative services. So I believe that we've streamlined providing these PrEP services, but I think we do still have a lot of work. And I think a lot of the panelists have talked about how we need to provide more education and training to support that PrEP just becomes a part of reproductive services. I think that's also part of the thing is you often in a family planning clinic, you're more focused on ways of preventing pregnancy, but often forget to focus on that. People are also coming here to us to find ways of preventing STIs and HIV infections and kind of rolling that into our care, changing the culture, focusing on making sure we're asking the right questions, or how are we asking the right questions of our women patients to make sure that they are providing with the information so that we can identify that they might be a good candidate for PrEP. I definitely think Planned Parenthood is a place that could definitely happen at because we already are a place where we do think about education and prevention and rolling that into how we educate our clients. So I definitely thought about ways that we should go about improving the culture around PrEP in our centers, and retraining, providing them with tools, also finding ways of reaching out to our clients, whether before they come in around with education material or online access to information about PrEP. But I definitely think that Planned Parenthood is a place where there's so many opportunities to grow and providing support to our staff and educating our clients around PrEP. And so, I really enjoyed getting ready for this presentation because definitely I realized how many areas we can grow and how we are very fortunate to be able to provide the service. Now we just need to really make it a culture of PrEP and prevention, including in that, all the prevention that we help our clients with.
Great. Thank you, Jennifer. And I really appreciate the learning that you've alluded to and the fact that HIV prevention is such a natural fit with family planning, and that PrEP reminds you of rolling out LARCs. Many, many years ago, it's kind of a similar process. I will be jumping over to hear from Dr. Deb Bourne, who is Deb has worked in homeless and HIV services for the last 27 years as a social worker, researcher, educator, administrator, medical director, and provider. Currently, she's the medical director for San Francisco DPH's Care Coordination and Transitions Division. She's also the principal investigator and provider for a SPINS grant, H-Home Mobile Integrated Primary Care for homeless dual diagnosed HIV patients, as well as oversees the SF San Francisco Homeless Outreach Street Medicine Care for HIV disease, reproductive health, and disease prevention in pregnancy. We'll hear from Deb about serving homeless and marginally housed women. Thanks for being with us, Deb.
Hi, thank you for having me. I think you have me last because I'm so maniacal and I could talk forever about this topic. I do want to say the points I want to get across. It was interesting when I was writing my bio and when you asked me to talk about this. First of all, I don't put doctor because I know that the key to all of this is us working together with our consumers and our case managers and our navigators. And as a medical provider, I understand I'm a seat at the table. And this is where success happens. The other thing is that as a woman, I have this hoax issue where how could you ask me to talk about PrEP? I haven't done anything yet. But in looking at this, it's been a real learning and a privilege to help bring the voice out and to let all of you know that are listening to this that anything we do is powerful and a change. I know that I can do the work that we're doing in San Francisco because of the amazing quality improvement and standardization that we've had around PrEP, the public health messaging where consumers know about PrEP and it's getting normalized. And also as an HIV provider in all of my trainings in the last 4 years, that PrEP is actually part of what we need to know about. It's in all our certification tests, et cetera. So I knew on a concrete level it was my responsibility. And from the first time I heard about PrEP from Susan Buchbinder, and we were going up to her and saying, what about injection drug users? And she said, well, that's a really good idea. And what about women? Well, we can look at Africa. So I immediately couldn't find what I needed 5 years ago to actually start to address the population that I'm serving. In San Francisco, just in general with homelessness, what we know from the community viral load research that came out in 2008 that kind of really pushed the national AIDS strategy is that homelessness itself is a risk for an increased community viral load. And in the general homeless population in the United States, 3% have HIV. In San Francisco, from our recent data about 3 years ago, 7% of the general homeless population have HIV. In the population that I serve, which is high utilizers or over 10 years homeless, that's 13%. And what's phenomenal and heartbreaking is 5.3% are women, much higher than the national average. The work that I do with my team is really looking at barriers to care and how to actually make low barrier access possible, specifically because the people we serve have so much trauma related to their violence they have personally, but trauma that they've received by we call sanctuary trauma, going to places to actually get care. And as an IV drug user, a woman, or someone who goes to the street, people are very marginalized when they actually go to seek care, and people are reluctant. Often the people that we serve have trauma and they play it out through their addiction. That also makes things complicated. And I have never met a human being that doesn't care about their health. And one of the things people assume is that if you're injecting drugs or you're living on the street, you don't care about the health. But I haven't been to a doctor, don't tell my mother, in 6 years. I don't have the same kind of survival competitions. And when you're dealing in the now, being able to get care in the now is really what it's all about. So we were so fortunate to get this SPINS grant, an innovation grant from Ryan White, to do healthcare for the homeless, but do it out in the street, outside of a four walls clinic, decreasing that barrier. And we used a lot of the techniques that were going on in San Francisco, something called RAPID, where someone gets tested, they get started with medication right away. So all of our folks had that. We have an amazing integrated clinic where the case manager, the navigator, the nurse, all much more important in getting people to the adherence than even what the provider is doing. And lastly, we have a great community partners with the homeless outreach team and with API Wellness, which is a drop-in program. And they hold our medication. People come in, pick up their pills. We go out in the street with the pills. My health team has Septra in a bottle. We're ready to go wherever we are. And we've had amazing success in our cohort of about 100 people with a 63% viral suppression. And that means human beings can take medicine without going into a clinic. And that's been an amazing experience. However, in the process of all this, early on in 2014, we had one new infection, male, and another gentleman who were just getting back into care, and their partners out in the encampment were amazing and actually helping us get them into care. And I saw them. I have a research grant. I can't help you directly, but I'm from the homeless outreach team, and we refer you to PrEP. And they were really excited. They were interested. They were going to UFO studies and getting tested and all that jazz and all these places, and to Needle Exchange. I know you can get PrEP somewhere. And in front of my eyes, to both of these women, because seroconverted. So I realized in 2015, I wasn't responsible, but could have helped stop 6% of our women getting positive. And that for someone like me, with tears in my eyes, that's really overwhelming. So Shannon knows, Nika knows, I became a yapping dog, asking for help, even protocols, asking for money. My funders were wonderful. I took actually one of the women, who's been a great teacher for me, to the meeting when the funders came to actually do our review, and introduced her, and she spoke to them about her experience. And I said to them, we need to stretch what we're doing with our research. And she talked to me a lot. I said, what would you have done? She said, you should have just given it to me. I want to give it to other people. I didn't know. So I realized I couldn't wait for the money or the funding, and we were just going to start now. And Ryan White and SPINS were great that we started to take on discordant couples. So we had 3 discordant couples, meaning the male was positive, the woman wasn't. The day that they either tested, we had one man that just tested. We got them immediately on what PrEP, and then PrEP. I was moonlighting in a methadone clinic, so I was able to actually dispense it at the window. We had it on hand, and all 3 of them started medication. Now, one of the partners, male partners, wasn't ready to take the medication, but the female partner was. So we had 3 women, and I think the 2 babies doing very well. One of the women actually decided to get a termination, and what was really heartbreaking is we couldn't give her the clinical case management and support, but we're still actually to this day giving her PrEP at the window. I can't say that we've gotten all the same kind of technical follow-up and blood work and everything, but we are HIV tested quite regularly. The other thing that we've been trying to do is actually get HIV medicine and PrEP. That's where people are staying. Many of us see people living in tents, and that's where I personally had seen the seroconversions happen. And unfortunately, in San Francisco, we've had several acute HIV infections, couple with women in some of our encampments. And I hate to be right about these things, but prevention, where a lot of our funding, like Shannon says, goes to MSM and trans women of color, where we are seeing a lot of the epidemic, they're willing to go up to the encampment. So 2 weeks ago, right before Christmas, we went out with a lot of our community partners, Glide and AHP, and went and did some testing. One more minute. And we used a nurse from Street Medicine. We had Lynx Navigator. We had some medical vouchers. We had starter kits. We started 2 people on HIV medicine that were positive. And when I was saying I was offering this PrEP to anyone, to the testers, one of the testers said, well, heterosexuals, do they use PrEP? And I said, if even us who are here on the front lines don't get and understand this is pretty deep. So in the future, in the perfect world, I would like to see drop-in needle exchange and other places, food banks, wherever people are going actually have medication, specifically PrEP, because we know that that works. That the model that we're using for MSM and trans, that people can go to the Castro to a storefront clinic, and Strut has been amazing. And I've found people on the street didn't know where to go for homeless services, but knew where to go and had PrEP in their pocket because they got it at Strut. So I know that works. I know using Peers works. And my client is ready to be hired anytime someone wants to get me money to go out in the encampments. She's ready to go. Our materials, we went out in the encampments, it was interesting. They had the 90% adherence data on the information. And we realized, wow, we're really not ready to go out and rock and roll with women yet. So we're making new information. Lastly, I know that for Dr. Barry Zevin, who's the medical director for Street Medicine, we're looking at low barrier care, and we're partnering Sabaka Home and Family Planning and Low Barrier PrEP. So I want to thank the incredible teaching of the women that did convert, but they want to make sure that doesn't happen.
Thank you, Deb. I really want to honor you for the heart that you pour into your work every day. It's really amazing, and the humble ways in which you've learned from your patients. I hope that we can all embody a little bit of that as we move forward. I just want to thank all of our panelists and for taking your time here today and sharing the knowledge that you've acquired through trial and error and just your work in doing this. Before we open up for a couple of questions, I would like to share a few resources with you all, and I'm going to go ahead and screen share some slides. And I'll ask my co-panelists to confirm that you see what I want you to see. Yes? You see my slide set?
Yes.
Great. Okay, so I want to talk about a couple of resources on hiveonline.org. We have various resources, printables, videos, hangouts on other topics, etc. You'll find resources for providers, again, videos, even sample order sheets, tons of stuff for patients too. There's a blog that I'll talk a little bit about. There's videos of patients' experiences. Those are really powerful. Here are a few examples of some of our printables. We have lots of stuff on safer conception. Is PrEP right for me? That's really geared towards cis women also. There's one about PrEP during pregnancy that's really powerful. And our blog highlights stories and voices of people living with HIV, also women who use PrEP to conceive for sex or for sex, trans folks, innovative collaborators. These are some of our newest blogs. We're seeking women to share their PrEP stories and men living with HIV to share their stories around family building. Our hope is that these blogs will reach the 468,000 women in the US who are at substantial risk for HIV acquisition. We also have this wonderful Please Prep Me card that Miranda showed and a couple people talked about. PleasePrepMe.org has created palm cards that raise PrEP awareness among women. as well as link women to local PrEP resources. These are actually customizable to your location or clinic. So if you're interested in maybe getting some with your clinic information on it and sort of leading people to the services that you provide, contact us and let's see what we can come up with together. I want to shout out the U.S. Women in PrEP Working Group and others who together crowdsourced a PrEP for Women resource page that is alive and well at hivonline.org /PrEP for Women. There's lots of resources listed, including social media stuff that you don't see up here. And then lastly, I just want to share a call to action about moving forward. Let us innovate more and more comprehensive ways to take care of women, given that there's competing clinical priorities, there's vulnerabilities that change over time. Let us engage trauma survivors in HIV prevention. How can we provide not only equitable services, but services that actually reduce disparities? And I wonder, what's the next step you're going to take? How will you champion PrEP for women going forward? These are some questions that I have for the audience. With that, we're actually over time, but I would love to invite a couple of questions. Let's start with one for Miranda. Miranda, will you tell us about how many women are on PrEP in San Francisco, and according to the PrEP Cascade, what should that number look like?
Yeah, that's a great question. So we currently have about 60 women on PrEP in San Francisco specific to our primary care clinics. So there are other women who are through our STD clinics and other community partners, but for kind of the data I have access to, our primary care clinics, we have about 60 women. That number should be considerably larger. We actually have the privilege of working with our epidemiology team here in the city to get some data on folks that we might consider high risk, and these are folks who tested positive for a rectal STI. And so that's really just one very broad way to capture, and again, misses a lot of women. And even within that population, we're missing a considerable number of folks, about 30 to 40 women. We also know from chart reviews, I had the very exciting job of spending about a week of my time doing hundreds and hundreds of chart reviews in our electronic medical record system. And we found just dozens of women who had even mentioned that they had an HIV positive partner and were never offered PrEP, or who said, I might be interested, and the provider might have said, let's follow up at your next appointment, and now it's 12 appointments later and that was never offered. So we're missing hundreds of women who might be great PrEP candidates.
Great. Thank you. I had a question which can be for any panelist, but we had a viewer ask about women living with HIV or women on antiretroviral therapy and sort of impacting PrEP candidates and around sort of side effects, etc. Anyone have thoughts on how potentially women living with HIV who are on medication can sort of have supported this effort around PrEP, etc.? Anyone want to talk about that?
Yeah, I'd be happy. So one of the groups that I work with is actually a group of women living with HIV. They're part of our sort of patient advisory team at Ward 86, and they are hugely invested in being champions around PrEP. And so they actually invite me to come a couple times a year, talk to them about updates, answer questions. And a lot of these women talk about their stories of how they acquired HIV and how they felt like had PrEP been an opportunity at the time, they wouldn't be living with HIV. And a lot of them are mothers, they're community members in their houses of faith, and it's incredibly important for them to kind of take charge of this information and share. And so I've had a couple of them come back and visit me in clinic and bring a daughter with them or a niece or a family member. And it's been really empowering to have those conversations. And so we get to work closely with women living with HIV.
Anyone else want to jump in?
Yeah, I just wanted to chime in, and I think that some of the most kind of powerful and inspiring stories I've had about the importance of outreach to women has been from conversations with women living with HIV. And I think for me as a provider, Deb talked about some of the kind of clinical experiences that bring tears to her eyes. For me, it's been seeing moms living with HIV who got through a pregnancy without having a perinatal infection, but then watching their kids get diagnosed with HIV. And I think that not only in terms of peer networks is it critical for women living with HIV to know about PrEP, but also in talking about to the next generation. They are really, really, really powerful storytellers. And also an important group to make sure that we dispel myths. And so I think just in so many different directions, whoever asked that question, you are so critical, and thank you.
Great. I just want to chime in and say what a vision it is to think about HIV neutrality and to think about supporting women living with HIV and treatment as prevention, because undetectable equals uninfectious, and supporting women vulnerable to HIV and accessing PrEP. This is kind of a circle and a cyclical thing for me, and that we are all in this together. So I really appreciate that. It looks like we are out of time, and unless anyone else had anything to add, I'm going to go ahead and close out our Hangout today. I just really want to thank you, Claire, Deb, Nika, Miranda, Shannon, and Jennifer, who popped off, for being here with me today, walking on this incredible path every day as you do. And with that, I'd like to close. This was Hangouts with Hive.